Hello, today I would like to talk about hormonal balance. Many women go through hormonal changes. Sometimes it can start as early as late 30s and it can go into early 50s. It really depends on the family history and a woman's lifestyle. Initially, the symptoms can be very subtle, not directly attributable to hormonal change. And a woman may continue having regular periods, but well-being and health altogether changes in a very subtle way. I see women complaining of more fatigue, body aches. Some women have difficulty to lose weight even though exercising the same amount as before or even more, and eating less, modifying the diet from before. Some women also complain of such subtle symptoms as a brain fog, mild forgetfulness, mood swings. Sometimes mood swings can be worse around the period, and if before, years ago, it was just a couple of days before the period, then the PMS symptoms can increase in duration and sometimes can last up to 7 to 10 days before the period. The period can be prolonged even though regular, and most of the cycle the woman feels out of sorts. And these symptoms may not be directly attributable to hormonal balance, just on the initial questioning, and it's important to look at other causes. But many patients will have normal blood results, and when you ask more questions and check hormones on 2 or more occasions, then there is a suspicion that it may be directly related to the hormonal disbalance. And granted that the periods are regular, the woman ovulates, but there are subtle changes, the hormones drop, and that's usually what happens. Both hormones, estrogen and progesterone, can decrease, but progesterone usually drops more than estrogen, and those symptoms are usually related to estrogen dominance or relative hyperestrogenism. It's important to rule out other things, especially adrenal and thyroid causes. Make sure a woman doesn't have anemia. Make sure there is no infections. Lately, for the past couple of years, I see more and more patients with Lyme disease. So it is very important to do the test for Lyme disease, because Lyme disease is a great imitator and can have psychiatric and neurologic symptoms as well. Another important thing to check is vitamins, especially vitamin B12 and D. And if they are low or outside of the normal range, it's important to address them. And sometimes the symptoms will get better. But ultimately, it is important to address those shifting hormones. I recommend my patient a stepwise approach. The first thing after I evaluate a woman and have a suspicion that her hormones may be a little bit out of range, I will talk to a patient about healthy lifestyle. Diet and aerobic exercise, preferably every day, at least 20 minutes, can take you a long way. And in terms of the diet, there are 2 directions that I discuss dietary changes. The first one is to decrease inflammation. Even though the woman's hormones stay the same, in the environment of low inflammation, the symptoms will improve. And most pro-inflammatory foods are all processed foods, sugar, also carbs, especially simple carbs, because your body turns them into sugar, especially wheat, and some nightshades. White potato is the most pro-inflammatory out of all nightshades, and this is the first thing I recommend avoiding. Avoid processed foods, sugar, simple carbs, especially wheat and white potato. Increase the amount of green leafy vegetables and eat a more balanced diet. It's also important not to overeat. Generally, people eat more than required for healthy energy production, and eating more requires your body to spend more energy digesting the food, and that can also cause different symptoms as well as fatigue. So portion control is another important area that I concentrate on. And once a woman is eating a healthy diet, there are 2 areas that we concentrate on. The first, there are foods which can balance elevated estrogen or estrogen dominance, as I mentioned. And those foods are sweet potatoes, yams, tofu, also healthy fats such as avocado and fish oil or flaxseed oil. Those foods will balance estrogen dominance. And the second group of foods will help your liver detox excess estrogen. So the other group of foods will boost the liver function, helping the detox. And those are vegetables, all cruciferous vegetables, such as broccolis, cauliflower, cabbage, Brussels sprouts, kale, and beets. Beets are excellent detox vegetable, and you can cook beets, you can juice them, you can put them in smoothies, you can make soups, baked beets. So those are foods which are really good to help your liver. And I also want to mention a couple of herbs which are also beneficial to either help balance excess estrogen and help your liver to detox excess estrogen. Herbs balancing the excess estrogens that I recommend to my patients are shatavari, available as a preparation in capsules. It's actually an Ayurvedic vegetable, and it's available in capsules. And shatavari is excellent at any point in a woman's life when the hormones shift, such as menarche, postpartum, as well as the perimenopausal symptoms. CoQ10 is a supplement that brings down the inflammation, and when the inflammation is down, the estrogen dominance becomes less pronounced and the woman has less negative symptoms. As I mentioned, omega-3 supplements, either fish oil, flaxseed oil, krill oil, those can be taken as a supplement. The other group of herbs is to help your liver detox. Another herb that I would like to mention that balances excess estrogen is raspberry leaf. And raspberry leaf you can either take as a capsule, you can brew tea from it, and that's beneficial to balance excess estrogen. The herbs which help your liver detox excess estrogens are milk thistle, dandelion root, as well as nettle. Nettle is an excellent detox herb. It's not only good to detox the liver, it also detoxes the blood very well. So those are just to name a few. There are additional herbs and supplements which can be taken to either off-balance excess estrogen or to help your liver detox excess estrogen, but those are usually next step. I don't want to overwhelm women with too many supplements, and this is the first that we start. And I give about 3 to 4 months time period to adjust to the supplements, to adjust to the diet, and most patients do develop improvement in symptoms. Many women do lose weight. If there are hot flashes, they get better, moods become much better, sleep is better, PMS symptoms improve. That's the first approach. The second step, if a woman still continues to have symptoms, there are various supplements. Those are more combination supplements, and I like Metagenics. Metagenics has an excellent supplement. It's called Estrovera, and those are made from plants, and this supplement is great for women who actually have hot flashes, poor sleep. This is a more effective treatment in addition to the diet, aerobic exercise, and herbs. There are homeopathic medication that I also recommend women who have symptoms which persist despite the initial diet and exercise. And the most common homeopathic medications that I use are folliculinum. Folliculinum is actually homeopathy made from a hormone, and it can be taken in a high dilution such as 30C or 6C based on the symptoms. In women who have estrogen dominance, usually you need to take a higher dilution. And this homeopathic medication does not need to be taken every day. It's very potent, and many women just need to take it occasionally based on the symptoms and more individual presentations. If a woman does have hot flushes, Lachesis is an excellent homeopathic medication. Belladonna can be taken and it helps some people, but in the long run, it's not as effective. Lachesis is a more preferred homeopathic medication for hot flushes. There are a couple of homeopathic medications which help your liver to detox. And lycopodium is a great homeopathic medication for that. And another homeopathic medication that helps the liver detox, in addition to lycopodium, is Hydrastis. Hydrastis is a great homeopathic medication for many different indications, but it does help the liver drainage and helps detox. But homeopathic medication should be chosen more carefully and more individually as opposed to supplements. I did mention briefly the importance of aerobic exercise. Daily aerobic exercise, at least 20 minutes, and aerobic exercise is considered effective when you either sweat or when your heart rate goes up by at least 50%. And usually it's required both sweat and increased heart rate for the exercise to be considered effective. Aerobic exercise decreases inflammation. Those are first steps. For each woman patient, I write down all my recommendations, and I also recommend the patient to keep a symptom diary. And sometimes if a patient just doesn't pay a careful attention, she may say, oh, I'm feeling the same after doing this for a month. But then if you start going into detailed questions, then many symptoms do improve. Before, PMS was lasting 2 weeks, but now it's only a couple of days, and the periods get more regular. That's why I recommend a woman to keep a symptom diary, and generally addressing a few different symptoms such as mood swings, PMS symptoms. I do recommend women to check their weight every week and see how that is doing, and also how the appetite, because once you decrease the inflammation in your body, the appetite decreases, and it's easier to stick to smaller portions. Those are first step approaches to women with hormonal changes. Many women do feel better and the symptoms improve, and generally lifestyle quality improves with those dietary, exercise, as well as supplements. But some women still have residual symptoms, and even though feeling better, their lifestyle is still affected. In those women, I do discuss the possibility of bioidentical hormonal replacement therapy. Bioidentical hormones are hormones made from plants, and it's estrogen, progesterone, mostly made from plants. And bioidentical hormones are called that way because their structure is identical to human hormones, to human estradiol, estrone, estriol, as well as identical to human progesterone. Synthetic hormones, they have a different structure, a more complicated structure than human hormones. Synthetic estrogen is actually has a side chain which is much heavier than natural human estrogen, but the active part is the same. And due to this heavier side chain, a woman may have more side effects from synthetic estrogen as opposed to bioidentical estrogen. And the progesterone which if you're not using bioidentical progesterone is actually a combination of different progesterones, and those are obtained from urine of a pregnant mare. And those are also, there are several different progesterones having different structure, but the active part is the same as a human progesterone, and that's why it will work to decrease the symptoms of perimenopause. But because of those combination different progesterones and the side chains, they may cause more side effects. Bioidentical hormones, they are much safer than synthetic hormones, but it's still a prescribed medicine and it has to be addressed carefully. There are certain monitoring that's required when a woman takes bioidentical hormones, but that's a very effective answer to more severe symptoms, although bioidentical hormones are usually prescribed by a doctor and requires a careful follow-up. Although there is one hormone, progesterone cream, phytoprogesterone, meaning progesterone made from plants, is available over the counter. And sometimes if a woman doesn't want to do bioidentical hormones, but she's taking all the supplements and doesn't get adequate relief, I do recommend taking progesterone cream and applying 50 grams or just the recommended amount on the bottle to the skin, outside of the exposed areas of the skin, and that also offsets estrogen dominance, and many women feel better with just doing progesterone cream without prescription hormonal replacement therapy. But even a woman does do the progesterone cream topically, it still can cause side effects which have to be monitored closely. A woman may have heavier bleeding, weight gain can be present, but then decreasing the dose usually solves the side effects, and the woman still continues to have benefits to control the estrogen dominance. If you still have symptoms of hormonal disbalance after addressing the initial symptoms with diet, exercise, and supplements, please contact me for a personal consultation where we can discuss more personal approach with additional supplements, homeopathic medications, and possibly prescription of bioidentical hormones.